kind of going back to my starting position for most of the posterior palpations, I'm back on the iliac crest, bringing my thumbs down and back, and where my thumbs hit, you can also look on a lot of patients, you'll see little dimples, should be my PSIS, my posterior superior iliac spine. And so you can kind of palpate superiorly and inferiorly, appreciating the full ridge there. Coming inferiorly, you should feel that inferior border of the PSIS. Superior, you'll start to fall off into more soft tissue back onto that iliac crest. So that would be your PSIS. And then moving medially from that, we talked about this on Wednesday, what would I find medially from my PSIS? My sacral sulcus. So you can feel just the little divots. And then at the level of those PSIS, if I move again straight medially from there, I'm going to feel another spinous process. What level should that be?
S2.
S2. So I'm going to find my S2. That one's going to be important later when we get to lumbar gunny. That'll be one of your landmarks for measurements. So finding my S2 spinous process at the level of the inferior aspect of your PSIS. Does that make sense? Okay. And then the other thing that you can do is palpate those full lines, the full borders of the SI joint. So it's not like your AC joint where it's just, you know, one finger width. Your SI joint line is actually the whole length of where your ilium and your sacrum line up. So it's a full line. Oftentimes it'll be tender or sore on patients. If somebody is having low back pain or SI joint pain, that's definitely an area you would be treating. So I don't think that might be is that a testable structure, the SI joint?
We won't put that on
but it's
the
good
practical. To know. It's a hard one to really like pinpoint
yeah.
and identify, but it is very important clinically, which is why it's on the list to go over
yeah.
the lab. So that's why there are just some discrepancies between master list and yeah. The lab list. Looking at it, I would say generally the lab list would be everything that's testable, but you guys, you know, are better than that and want to be great clinicians one day. So all the other things that we talk about, still
I work on an
sure
aerial log on patients, so I would definitely at least get a feel for it.
I think that's a good point
yeah.
to stop.